So, James, you can see my screen?
Yes.
Okay, perfect. So let me start with just saying that we had three main questions we were thinking about when we were building this app. How can we develop early movement analysis skills? So is it useful to look at bar charts of muscle activation? Or could it be more useful to look at bar charts when you have an image of the movement so that you can actually see why these muscles are working? So to have those side by side, or the same idea related to these range of motion charts. Are they useful to look at in isolation from the actual movement? And so these were all the things that kind of drove the design of the Gait app. We also really want to reduce the time hunting for videos. I think all of us are very skilled at looking for videos that we want to use, which may not be there next time when we try to use it. And so could we just do a better job at organizing this content and making it easy for faculty to rely on, easy for students to watch over and over again, and then easy for students to reach back into as they go throughout the semesters, throughout the entire curriculum. And then lastly, could we develop case studies that would help take this year one course and build some bridges forward into the orthopedic course, into the therapeutic exercise course? Like, could we take everything that they're learning about gait analysis and allude to the idea that there are impairments? And these impairments are things that they're learning to assess in the concurrent range of motion or MMT class. So those are all the little things that kind of drove our decision on why we built the app the way we did. So I'm going to take us right into the curriculum here, or right into the app. Let me go to my browser. So for those of you who do not have access yet, for those of you who are new faculty who have not used PhysioU, you usually just go to physiou.health or physiou.com, either of those, and you just sign in. Now, all faculty have full faculty access. You have access to use this in your teaching as much as you like. This is PhysioU as a group of faculty building this. This was our gift to our own, which was we need to reduce faculty burden because all of us are working so hard to try to do a good job for our students. So once you sign in, you're brought to this big cluster of apps that we've created. The easiest way for you to find apps that you want are usually through the filter. And so Gait, range of motion, MMT, assisted devices, all of these are considered what we put into the fundamental skills group. And so you'll see that I've just sorted to the fundamental skills. Here's the neuro rehab. Here's the orthopedic, right? Exercises related to orthopedics, taping, splinting, patient education, special test. So if I go back to the fundamental skills and I click on Gait, I had been floating this idea in my mind almost from the beginning, 7 or 8 years ago, thinking about Gait and why it was so hard to learn about human movement. And so we decided to build two main phases. The learn phase would be designed around static images. We think that it's just too hard for students to grasp the basic knowledge when they're staring at videos all the time. So here, if you click on phases, and I'm going to bring that up a little bit closer, you can see that here are all the different phases. Each phase always has a reference image because I think that's part of how students learn today. They're very visual. Of course, there's all kinds of learning styles. And here in the phases, you can see that there's always a reference image and then the phase description, defined as the instant the foot contacts the ground. From there, you can move into the range of motion requirements for that phase. So here is your graph. Hip flexion, 20 degrees. So hip flexion, 20 degrees, and you can match that to the graph here. All of this data we got from our wireless EMG in our motion capture lab. So here is the EMG data. Her foot without the anterior tib would slap on the ground in initial contact. That's a useful way of looking at muscle activity. It tells a story that is tied to the human movement. And then finally, the critical events. So I'm going to make that a smidge smaller, and you can see that we have tried our best to make sure the language will match whatever language that you use. It should match as you're teaching the students about critical events. So the students can really go through each phase and just learn and really explore at a much slower pace. Our students are instructed to explore and learn about the phase description, the range of motion requirements, and to look at the image first, identify what they think the movement requirement is at each joint, and then look at the reference graph. The same thing with EMG. Of course, this we're going to discuss in class, but today with PhysioU and how I've been thinking about education, I think we do a much better job when we can create a graded exposure experience for the students. It should not be the first time that they see this when they come to class. I would love for them to have explored it and kind of soaked in it a little bit so that when I come to class, nothing's new. They're just ready and waiting for you to weave the story, to make the narrative of what all of this means and what it means clinically. So I think that from a guy who's been teaching entry level for about 20 years now, we really can rethink the model now that you have resources like this that are in the student's pocket, right? They don't have to wait for you to click on a link to show them about Gait. And then here's the critical events. So all of these things, and I'll make that a little bit bigger so everybody can see that. All of these things the students pre-watch before they come to class. When they come to class, we can make that much more engaging then. We go to the analyze phase. So here is the analyze phase. And in the analyze phase, you can see here's normal. Here is regular speed. Here is close-up slow motion. Here is a different view, slow motion. So just like we would do it in the clinic, we've created that environment here in the app. And then here is front slow motion. And then here is real-time range of motion. So oftentimes we will stop the video right here and say, hey, what phase is this patient in? So we'll engage with the students. What did you learn when you were watching all of these videos? What phase, what range of motion is occurring at the hip, the knee, and the ankle? And we'll just play throughout all of this. We'll just play and stop and ask the students to identify the different phases of Gait, the different critical events. Think about how different that is from how we traditionally taught it, which is, I'm going to talk to you about all this stuff, and then you're going to go away and study it. Now they expose themselves to it. And then when I'm in class with them, I engage them with analysis. What phase is this? What critical event? What have you learned? What kind of, you can even tease it out, right? What muscle might be weak when this, when they don't get enough hip flexion, for example. What joint might be stiff if they're dragging their toes across the floor. So there's all of this interesting ways for you to leverage the resource so that your face-to-face class is so much more high. I mean, you can build from very low level to high level. And I think that's the flexibility that using this resource potentially can help with. So that's analyze. And so we can go to deviations here. You can see that the deviations are organized by body region. Let me take you to knee, for example, and we could look at genovalgus. Here's the side view, which is not as relevant. Here is the front view. And when we talk about these different faults, and this is a patient, a real patient that's had patellar dislocations. Here's the associated phase, mid-stance, the potential cause, which I think is a great way to connect to their range of motion MMT class. right? And some explanation of some potential penalties. Why is this fault potentially a pain generating mechanism, right? Lateral patellofemoral joint compression, tensile forces on the medial knee structures. Think about how much further your gait, talking about gait and their deviations, can be taken. Let's take a look at another one. Here is someone with Varus Thrust. So she has knee osteoarthritis. Let's look at her here. You can see the enlarged joint line, medial joint line. We can talk about the compression at the medial condyle and femoral plateau or tibial plateau. Here's the associated phase, some causes, some potential risk factors, some potential penalties, and some possible gait corrections. So we just went into the literature to take a look at what's available out there. So really, as a faculty member, and James, I'll get to you in just one sec, you have the option of going very superficial. I'm going to expose you to the different gait abnormalities, or I can take you deeper and talk a little bit about potential impairments that this might imply. How powerful is that? So let me take a pause here. And James, any thoughts or comments in the chat?
Yeah, a couple things that you mentioned without even knowing you mentioned it. You know, one I think is that in education, as I taught for 26 years, we're having to teach more in either the same, if not less time. And so the pre-exposure of the students to it allow you to then just ramp right into the analysis. It's not threatening. They go at their pace. They can review it as many times as they have to. And I think it's a very safe, graded exposure for them. The other thing is that I think Gait class, and I loved it in the curriculum I taught, it's kind of at the end of the first year where we finally now had to do two things. One, integrate previous knowledge, so it would reinforce that knowledge they had earlier. If they have the earlier PhysioU apps, they can always go back and look at the anatomy and the biomechanics and stuff like that. The second thing is that it's kind of a safe place. Like they start doing that analytical cell analysis, and you said that you get right to analysis. If they're wrong, hey, it's the video. You're not hurting a patient. You're not doing too aggressive of a stretch or too aggressive of a mob or anything like that. And so it's safe place for them to start practicing how to think things through. And so I think that's really good. And the last comment is that you really with this now start getting into that the identification of the impairments and getting that impairment-based mindset in terms of what's going on. And so it really starts, I love Gait. I think it really starts the ball rolling to be a doctorally prepared, analytical assessing individual. And even for the physical therapist assistant to be able to understand what is happening with the patient by the physical therapist's directives and stuff like that. So I think it really works well. I love this Gait. I love this app.
Yeah.
I love the topic. I think it just starts bringing everything together for the student.
And the other thing I would say, and then I'd love to open it up for faculty just to ask some questions or make some comments. Think about you at this point in the curriculum, we have this golden opportunity to talk about movement, to talk about faulty movements and impairments that may be related to these faulty movements. Imagine what that does when you finally get to orthopedics and you're talking about people who have sprains and strains of their low back, who have plantar fasciitis. When you have connected those dots early, meaning you've built into the mindset of the young student, right? It's a fresh brain. You've built into that when you look at movement, it's not just an identification of the movement fault that is the endpoint. The endpoint is identification of the movement fault and then the curiosity to wonder what is impaired that may be driving this. Is it insufficient dorsiflexion? Is it talocrural stiffness? Is it calf length? Is it quadriceps strength? There's so many of these curiosities, these questions that you help to build into the young clinician that begins to create a frame that when we move further on into orthopedics and you talk about all the scapular faults that may be contributing to shoulder impingement or subacromial pain syndrome, right? The thoracic mobility impairments that may be contributing to shoulder pathology. That conversation, I believe, should have begun in the early fundamental classes, range of motion, MMT, gait, anatomy, because because we have a chance to actually create a clinician who thinks that way. So let me just pause for a second and ask any comments or questions. And please feel free to unmute yourself. Please feel free to unmute yourself. Any comments or questions, or anyone who has used this in their classroom and wants to share a little bit about how they've used it. And I'm just going through and I'm clicking. There are a few people who've joined us a little bit later, so you guys are all open to unmute yourself and make some comments. Kevin, do you have any comments? Okay, James, any comments in the chat?
No, just that they're liking what they're hearing and seeing, and I think we can enhance it. Also, those who are just coming on board, if you want it, there is a recording of this that will be posted. You all will get a recording of this. I put that in the chat earlier, but those who just come on board, don't worry, you didn't miss anything, because you can always go back and listen to the recording and catch up on what you may have missed in the first 15 minutes.
Right. Okay.
And then the other thing too, like the observational skill set I wrote in the chat that you get with Gait, it's the same thing you do when you're looking at scapulohumeral rhythm. I mean, it's starting to discipline the students to watch the movement phenomena patients are doing, whether it be weight shift or postural static event, or even the scapulohumeral rhythms example I used in terms of the skill set of observational critical observation skills.
Yes. So let me move on one step, and then guys, feel free to unmute yourself if you have any thoughts or comments. Actually, any thoughts or comments before I move on? Yes, Sumaya.
Hi, how are you?
Hi, great.
Okay, my question is, it's able that we can relate the kinesiology and biomechanics in the gait?
Could you expound that a little bit further? For example, give me an example of what you would be looking for. And James, maybe chime in as well.
Basic concepts for the students, those who are basics concept related to the base of support, line of gravity, and during that specific faulty posture, what happens in that situation?
Would that, yeah, James, go ahead.
Well, I think your question is very much more broader than it might initially think. Yeah, I mean, the biomechanics in terms of base support, the vector analysis.
Yes, exactly.
Yeah, like, that single point cane you see right now, if she puts it too far out, there's gonna be more of a shearing force and the cane's gonna slide out. I mean, that's applied kinesiology. I think that's also the job and the role of the instructor to say, now, what are the biomechanical principles that we have learned in kines in the class, usually it's prior to this, in terms of what's going on here, in terms of the patient's stability. A patient who walks a little more squatted because they don't have a base support, a sensation of it, could be a neural problem. And so, yeah, you look at like the Genu Varus.
I just want to relate the advanced and the basic concept in the gait.
Yeah, whenever we build the app, I mean, I think that the idea is very important. I mean, that's why we give them all of these basic biomechanic and kinesiology based type concepts. In the app, it's something actually James and I can talk about. We have tried to create a resource that is relatively uncluttered. And so a faculty member can then take any video that they want and talk about center of mass, base of support, all of these different things that they feel comfortable doing. I'm not sure whether you think that there may be some extra text that can be added below. Is that what you're talking about?
I just want, in the picture, there is a line present that only labeled and that shows that this is the it will increase the base of support, it rotates the movement. That's it, not a full text.
I see.
I think one thing that, and this would be a suggestion, Mike, I mean, you guys are hearing Mike and I think out loud now, is Inman's work with that almost like a 2 centimeter biphasic sinusoidal wave of the center of mass. And where the center of mass during like mid stance, that's at the highest and to the right and on the right lower extremity, and then drops down and goes to the left and back up on the left mid stance phase. And you can see that biphasic sinusoidal wave change left, right, up, down. So, I mean, there's a picture of that and adding that to the range of motion, you know, the slide where it shows where the center of mass migrates in a normal gait, you know, stuff like that. I mean, that'd be something we might possibly be able to add to a slide on this app.
You know what, Samaya, how about James and I reach out to you on a separate call so we could think that through a little bit more, and we can always do more things. I think what we've tried to do here is to keep it as clean and as simple as possible so that it is very uncluttered. But I think you have some great ideas. James, if you don't mind getting Samaya's email, and we can always touch base that way. It's a great idea. Other comments?
Okay.
Sorry, I was thinking about what she was asking. One of the things that we've seen in Gait videos before, sometimes it's just a simple vector from point of ground contact, and it just is one line, and then it moves, showing its relationship to the joints up the kinetic chain.
Yeah.
Mm-hmm.
And so just that simple ground reaction force vector.
Yes, exactly.
Oh, yeah. You know, that is definitely that may be something we could do. We have a force plate, and actually we've been using that for a bunch of the new functional movements that we're filming. So when we filmed this, it was purely a treadmill and a green room. There was nothing else, and we didn't have anything available at that time. So that's a great idea. And Paul, I can reach out to you as well, and we can talk through. Would that be more? I mean, it'd be really hard to redo all of these, you know, all of these pathologic ones, but certainly we could add a layer of that in the potentially on the normal side.
Yes, exactly, on the normal side. And then the other place that I found that very useful is in the teaching the prosthetic gait, because you can see that relationship of the ground reaction force to the joint of the prosthesis.
Yeah. Right.
Which, you know, that gives you some idea of how much, you know, flexion, external moments on the, so, and yeah, maybe just a normal prosthetic gait, transtibial, transfemoral. If you're going to do it, that might be, because it's not that cluttered, and I appreciate you're not making it cluttered, but just that, and maybe you could have it turn on and off like you have some of your other apps.
Right.
That simple ground reaction force vector is sometimes helpful for students to understand what are the forces across the, say, the knee or hip during gait.
Absolutely.
I think like maybe the next iteration of this, Mike, as we continue with the advanced, almost like the biomechanics of Gait app, you know, separate of this. Because I mean, if the individual instructor can go back to either app, you know, say this initial Gait app with the different things, so they learn the basic terminologies, phases, and what muscles are doing, concentric, eccentric. And then the biomechanic one can do the ground reaction force, center of mass, base support, vector analysis that occur with that. And then that's just kind of a movement analysis. And that stuff just bleeds over into everything, the vector analysis of upper quarter, you know, movement and stuff too. So something to consider in terms of our next iteration of Gait stuff.
Yeah, absolutely. I'll bring that up to Chris. He'd be excited to think about that. Yeah. Other comments or thoughts? Oh, Gail, please.
Hi.
Hi, Gail.
I'm enjoying, well, actually the discussion, the presentation. We have been probably using and trying to teach Gait in our school very similarly to the way you've set up the whole Gait app, from the very basic static shots to
Right.
move more into, well, normal. We do a huge normal lab whereby everybody they work in groups with gait rights and analyze their classmates and video. And there is a submitted assignment. And then they also administer or put some props on that interferes with that student's normal gait, and then
Nice.
compares the gait right and the video in their assignment back to us. But the thing that's beautiful about this, so we then use in their intro to neuro, which is where I tend to teach, we have then tried to use PhysioU to get them to review content, because they put all of that aside when they go out to their MSK placements. They come into neuro and they've forgotten basics about gait. So then we have used the PhysioU for them to do self-prep prior to this assignment, and also to get them thinking about something that's core to our practice in neuro. So the progression from static through to pathologic for us is very helpful. We have tended to use our own videos, but in clinical practice, because I wear two hats, it's getting more and more difficult to capture real patients.
Yes.
One-time commitments to their willingness, so to have this resource in one place, where I'm preparing to work into our senior module, and I'm looking at ways that we can integrate the more advanced PhysioU into that module, which is why I signed on today. So I will look more carefully at the case studies, but we use the same language, talking about the impairments, the penalties of impairments, and the possible causes. I mean, we use basically a table whereby they theorize, fill in, and we discuss. So it's great. It's great.
That's wonderful.
The only thing is cost to our students.
Yep.
Which they don't like because they're already paying a lot. That's an issue for the school to look at. Yeah. But I would say thank you ever so much for all the development that has happened so far. And we as faculty in neuro particularly, and senior module, are really looking at ways to integrate this more. So we're doing less of the prep that you've already done. Yes.
Wonderful. So happy to hear that. And, you know, when it comes to the cost, in fact, I was talking to a program yesterday, and this program said, we have eliminated 3 different textbooks, and that has made PhysioU's subscription cheaper than what it would have been with the 3 textbooks. And so I think there is, I still use certain textbooks in my class because I believe there's a certain level of depth of knowledge that students need to acquire. But it's very interesting because some of the students have pulled me aside in past years and said, hey, I just want you to know, most of us don't buy the textbooks that you're asking us to buy. That's just the reality. We share them. We don't see that you're using them that much. And so we just choose to not use them. And so I think we're coming into this new generation, for better or for worse. And I still try to get them to read the things that I think will increase the depth of their knowledge. But if you think about a lot of the different skill sets, right, we're unique in this profession in that so much of what we teach is skills-based, that perhaps the use of these types of videos and the skills-based videos can really enhance learning and minimize costs for the student, especially when you think about how PhysioU really covers almost every major content area in the curriculum. So I think it's a great thought. We are always thinking about that for our students, the debt burden that we bring to them as they come through the program, and also carefully rethinking the resources we are requiring them to take or to buy. Because if we don't use them well, it undermines the students' trust in what we're asking them to do. And so again, one of the things that you mentioned, I think is really important, is for faculty members to leverage this. Like I have this open on my computer every day when I teach ortho, and I go into it every day, because the more you use it, the more they value it and the more comfortable they become at making it a resource for themselves. Can you say that for any one textbook? It's very unlikely.
Right.
You know what I mean? So I really make a point to show them how this helps me to think, and how, and I make a comment actually oftentimes when I'm in the ortho app about how I would use this in the clinic, because I'm really thinking not just about how am I teaching them today, but how am I teaching them to feed themselves, right? Fish for themselves when they actually get out in the real world. And that is really where this type of digital tool that's floating around on their phone really changes the game, I think.
Thank you. Thank you.
Yes, thank you for the great comment. Let me piggyback onto the case studies. The case studies, you'll see in almost every major app, we've added case studies. And the way we've added case studies is we think that every time you teach something that's kind of didactic information, it deserves to be unpacked in a clinical context. We've tried really hard to use those case studies. Gail, do you want to mention something?
Sorry, I didn't get my hand taken down. Sorry.
Oh, no problem. So yes, if you go in, for example, and you look at this patient, so this is towards the end of Gait class, and we can have the students break up into little groups. Okay, this group is going to do the 20-year-old female with severe right tibial pain. Now, this is the beginning of PT school, PT and PTA school. They don't know a lot about the pathologies yet. And that's the beauty of doing this case study. I'm introducing them to the elements of the subjective and objective exam. I'm giving them context. Here's the chief complaint. Some people will say, oh, I get it. I think that's medial tibial stress syndrome. Some students have no idea what that is, and it actually doesn't matter. I'm going to talk about it a little bit, but I'll tell you that by taking Gait and allowing them to explore a patient pattern. So our orthopedic app is called Clinical Pattern Recognition. I'm trying to build patterns from the beginning of the fundamental classes that eventually become more complex and more flexible even as they go into the orthopedic classes and the neuro classes. So they've never heard of aggravating factors, but I think they can read it and they can understand what it means. Here's some easing factors. And then we ask the students in their little group, please answer these questions, and then we're going to have you discuss it with a group. So whether you're doing this synchronously online or face-to-face, the group can just come up, talk about what they saw, so they can be showing this video. So we'll go side, slow motion. And sure enough, she has pretty high arches. She may or may not have sufficient dorsiflexion. All of these are here hidden underneath these down arrows. And so we are guiding the students to go through a process of systematic evaluation of a contextually rich patient, and then allowing them to just talk about what they see. This is also a great opportunity for the faculty to showcase their expertise. I believe that as you are beginning to build your relationship, educational alliance with the students, they need to hear you as the expert. They need to hear the narrative that you bring to the table. This is what gives you the clout and the trust for them to follow you and follow what you say. And so this is those opportunities for you to take it a little bit further. Things that they might not quite know yet, you can talk a little bit more about it. You can say, hey, what kind of joint might be tight, right? What are some functional activities that might be making this problem worse? What are some other examinations that we're going to learn in orthopedics? So you can take this as far or as not far as you want, but we've built all of these cases for that sole reason. So there are some standard plantar fasciitis type cases. There are some I think this is prosthetic gait deviation cases. This is what the patient's complaining of. And remember, actually, our professor who's teaching P&O now, he goes back to the Gait app to use this later. So again, the resource, depending on whether your faculty are aware of it, it can be re-leveraged over and over again in multiple courses. And then of course we have some neuro patients here as well. So let me see, decreased balance. Oh, here is 56-year-old male with challenges in gait ambulation. So here's his story. His past medical history. What are some things that you see? And we purposely put the answers here because it makes it really easy for a faculty member, as the students are doing their discussion, to quickly go through and prepare their mind for discussion. And oftentimes I will just talk about what I see, and then I will open up the the drop-down menu, and the students, right, the visual students who want to read, who can't hear what I'm saying, this allows them to see what I'm saying. And then we can go back and look at the videos together. So Gail, I hope that this part, if you see the case studies here and how you can re-leverage it in your neuro class, we will often re-leverage this app in our ortho class. I would just pull these different cases up to talk about the knee arthritis, to talk about the plantar fasciitis. And now they have all these new skills that I can piggyback onto this case. And so the learning is really much deeper.
Yeah, I'm excited to move forward with ways to integrate this for sure into our next large unit.
Wonderful, wonderful. The last thing I was going to talk to you about is our virtual reality pediatric gait VR. So this is done in partnership with the University of Idaho and Dr. Edie Kendall, actually. So Edie had gone into her motion capture lab to capture children with different conditions. Some of these patients are real patients. Some of these are students with all of these markers who present with the exact same movement patterns as patients with real conditions. She did this because she wanted to protect the privacy of these patients as they grew older. So I think it was a very noble idea. And basically PhysioU brought it in to say, hey, this is a great way to actually take the gait analysis skills and now help the students develop pattern recognition for pediatric conditions. So here I am adding myself in here, and I will select a patient. So I'll go for Sarah here. What we've done here is we have integrated the Edinburgh Visual Gait Score. So we wrote to the authors like, we love the idea. Let's use a systematic tool and allow students to do their gait analysis. You can see, let me pause this for a second. The history of the patient is here. So it's a little bit small. I don't know if I can make it bigger. Sarah is an 8-year-old girl with diagnosis of right spastic hemiplegic cerebral palsy. She has been in PT since the NICU, seen in EI, and the school system. She is coming into your outpatient clinic today for a gait assessment and recommendations for orthoses. You decide to perform that gait score for her right side as a baseline for comparison. So you can close the instructions and start going through the Edinburgh Visual Gait Score. So as the patient is going through, oh, let me move this down a little bit. There we go. Sorry, my screen is a little bit frozen. We can say, okay, I'm looking at the right limb and I do not see initial contact in stance. That is toe contact. If the student doesn't know what this means, they can click on the information button and read about what we're looking for. And then they can close that, toe contact, and move on to the next item. Heel lift in stance. Yep, definitely heel lift. No heel contact in stance. And the other cool thing is maximum ankle dorsiflexion in stance. I'm going to stop that patient. let's see, right there. And I'm going to add my goniometer. Move this way. And essentially you can start trying to measure your goniometric measurements to try to address the Edinburgh Visual Gait Score. Let's move this up a little bit. I'm going to move this here, and you can change the visual height that you're observing the patient. You can also begin to rotate around to look at the patient. So we continue with the gait. I'm going to turn the goni off. And you can also stop the patient and apply a posture grid. So actually, it's better if I come into a proper posterior view. You have all of these interesting opportunities to cross use the stuff they're learning that they learned in range of motion MMT, posture, and their gait analysis. When they're done filling this out, there's a key. So Edie's gone in and analyzed it. The students will be able to cross-check, cross-reference what they got right and what they got wrong, and go back and look at the video of the patient again. So we're actually starting pediatrics class right now. Our pediatrics instructor uses this as part of the development of pattern recognition. They want to have their students see what are some common gait patterns and do an analysis. So they're using this in our program during the pediatrics class. Any comments or thoughts about this? Any comments or thoughts? Questions? Let me turn off the grid here. Gail?
I don't teach our PEACH section, but we've been using the Edinburgh Visual Gait Score for years as a really good tool to analyze pediatric gait. I don't know how much our pediatric instructor uses this, but I will be definitely speaking with her after this presentation, because I mean, she uses, again, clinical videos, but the opportunities to manipulate this and for the students to actually try and measure,
right,
and then be able to see the answers as they move it around, because students love to move. They love to move things to manipulate,
right,
much more than I would have as a student,
right,
because it's their lived experience. So I'm very excited to discuss this with her.
That's wonderful. Yep. I think it's really a cool tool to, again, you're building on gait, but you're giving them a systematic methodology of looking at gait, and then being able to have a key to bounce off of, then they can really refine their movement analysis skills. So that is essentially the Gait app and the Pediatric Gait VR. I'd like to just open it up for questions. Any thoughts, comments? Any thoughts or comments?
One of the comments might be that how to augment your lab handouts with the PhysioU app. If any of you folks have been able to do that, you don't have to. And the beauty of this, two comments I've heard within today was getting harder and harder to get people to come in and be patient with COVID and all the other stuff. And we have your stock ones here. The biggest thing for me, and this is my introduction to PhysioU 7+ years ago, was this, and I got tired of going on YouTube trying to find a gait thing that then the next year was not there, and I had to redo my handouts and stuff because of that. So
yeah, I thought about that, James. So you have a couple of options. One option, for example, is to take any one of our videos, open the sidebar. So you can see that there's a sidebar here, and faculty have this educator resource. that means that you can technically copy page title with link, open up a Google Doc or whatever your lab handout is or your lecture, and paste that link. That link is now a hyperlinked video. So imagine if your lectures, you could hyperlink all of our videos along with a thumbnail image. So that's copied as well. I can add it here. And now you have an image and the video link. You can resize the image, of course. An image and the video link that you can just click on, and it takes you directly into the app. So, you know, in Gait, I think it's almost easier to just come into the app, leave it open on your computer, and just talk about the different deviations and go through them systematically and have a conversation. You always do have the option of coming in here and copying the page title with link, copying the thumbnail image, and augmenting your PowerPoints. Because you could just make that a clickable link, you click on it, and the video will open in a browser. You can show it whenever you want. So that's one option. I did have a question for the group, and that was, would it be useful if we turned all of this information into drop-down menus so that when you are talking about forefoot contact, you can ask students without the answers being open in their, you know, available in their face, I suppose. You could have that, you could say, hey, so what's the associated phase related to this particular deviation? And then when students want to, they can click on the down arrow and reveal the answer. Would that be useful for faculty?
Yes, I've tried doing that, hiding things when I use the PhysioU in the prosthetic gait specifically.
Okay, got it. So I will have the team go through and rework the HTML so that all of these can now be hidden, so that when you're having the discussion with them, really you could just reveal the answer when you're ready to reveal the answer. It's great point, Paul.
And a very important thing, Mike, it's non-threatening. I mean, the students, I think, are going to be more receptive to, you know, well, let me put a guess out there. And that's what I love about this stuff, is that it's not like in front of the whole class, they're embarrassed or anything like that. It just really helps out.
Right. So any other comments? Any other thoughts or comments? I know we're running a little bit late here. The last thing I would just say is that if you, as a faculty member, just know that next week, next Friday, we are doing assisted devices. We're talking about assisted devices. So you can sign up here under Educator Faculty Resources. So Educator Faculty Resources. There's also the option for you if you want to explore more. In fact, this is Chris teaching with his Gait app in his class. And if you go to faculty here, if you want to explore more, all of our apps with short videos of how we use them in the classroom are all here. So if you talk about, for Gail, the neuro rehab, here is all of the key apps that we have that you could just watch like a 5 or 8 minute video. And if you have not signed up for your free faculty access, please feel free actually to reach out to us. You can basically click here, request access, and we provide free access for all faculty. If you ever have you'd like to meet with me one-on-one, I do that all the time. Please feel free to schedule a chat. I'd love to get together with you, listen to how your class is designed, and give you ideas of how this can really make your life easier as faculty. And I think really impact how students can learn. So this is pretty much the end of the webinar. James and I are happy just to chat. Any comments, ideas, or thoughts? Any comments from the group? All right. Well, thank you.
Mike, real
Yeah.
quick, at the beginning of the chat, 9:01 a.m., I put in your email address
Yeah.
and how to schedule an appointment with you. if there's any very specific particularities that you want Mike to go over with you with,
Yep.
including doing that, the lab, embedding those things into your lab handouts. So take
Yep.
a look real quick before it closes. You'll see Mike's email address and the website, the web address to schedule an appointment if you need to.
Yep. And faculty often ask, how do my students get this? Usually faculty will either direct the students. This is a required resource in many universities. The students will just come here and buy it themselves, or we can work with the entire department where the department buys it and builds it in as a course fee. And the third option is really we can work with a bookstore to get this to your students, and they can now use their financial aid. So I hope that you will see that we have tried very hard to create a resource that is more than affordable, considering that you have apps that will cover almost every critical content area. And if you haven't experienced any of our e-learning, we will be doing an extra webinar at some point about simulations and e-learning, something that I'm very passionate about, and we've been spending a lot of time figuring out how to build right. So thank you guys so much.
Mike, to realize that when they buy the app, it's not just the Gait. This is not a la carte. I mean, they get everything: ortho, neuro, cardiac, lines and tubes, MMT. I mean, it's the whole 10 yards. I mean, they get everything with that one price, so it's not just a Gait app only a la carte.
Right, exactly. All right, guys, thank you so much. Have a great Friday, great weekend, and look forward to being in touch with you. Please feel free to reach out anytime.